I'm Dr. Mache Seibel, and we are at the annual meeting of the Menopause Society, and I'm speaking with
Dr. Amy Clark.
And Dr. Clark, you are?
I'm a medical oncologist at Penn.
We just heard a very fascinating conversation by you, a discussion in your presentation about the complexity of following up women who have been diagnosed with breast cancer. I wonder if you could tell us a little bit about, particularly the earlier breast cancers, what women should anticipate in terms of the best way to follow up.
Sure. So after completing treatment for early stage breast cancer, which is obviously individualized, right now there are no standard scans or to the blood tests that look for cancer recurrence. Right now what we do is continue with annual mammograms, obtain MRIs if that is appropriate, and obtain annual blood work that looks at just regular cells and blood and chemistry and liver and kidney panels. But there aren't any other standard testing that is done.
Well, you commented that the big cutoff between the hopes to cure was between stage 1 and stage 3, that many of those women will be cured, particularly stage 1 and 2. You talked about a number of other tests now that are being used to follow up women. Could you just mention briefly about it?
Yeah, they're not being used to follow up, they're being tested.
Tested, let me clarify.
Tested in their utility.
They're being evaluated for
Exactly.
follow-up for the future.
Yeah, so what we understand is some cancers are going to recur, and we understand that some cancers will go into a state of dormancy in which they're sort of living in the bone marrow, they're not replicating, but they're not dying. And then they can reawaken, go back into the bloodstream, and then become a frank metastasis. And once the cancer is metastasized, it's not curable. So these cells live in the bone marrow, and we can actually detect them by a bone marrow aspirate. So that's putting a needle into the hip bone and taking out some of the liquid bone marrow. That's not a perfect test, but it's the test we have now. When the cells are awake, they also will shed DNA, and we can detect that in the blood. It's called cell-free DNA. And sometimes we can even detect circulating tumor cells in the bloodstream. So those are the tests that are being evaluated to see if not only we know that if someone has them that there is a higher risk of recurrence, but we are investigating trials using therapies to try to get rid of them to understand if that will improve the recurrence rates.
And what's the likelihood that someone's going to be able to get these kinds of tests around the country? Are they in specific places only?
Yeah, so our clinical trials are done at University of Pennsylvania. So one of our trials that is evaluating patients with estrogen receptor positive breast cancer is also being conducted at University of Washington, Dana-Farber, Indiana University, and Georgetown.
Mm-hmm.
But those are the only sites that I know of right now where this test will be available. There are other investigators that are looking at the blood-based tests,
Mm-hmm.
but again, I think understanding the blood-based tests I don't think capture that dormancy that I was talking about.
Mm-hmm.
And so those are the places where the bone marrow aspirate would be available.
Well, thank you very much. Fascinating.